Raghu.
Anand, Mr. Anand Kumar Annamalai, is a senior occupational therapist here in UK. I won't give more introduction about him, but I will let Anand introduce himself to you all. A brief introduction of yourself, Anand, please.
Myself, Anand Kumar. I started my career as occupational therapist in 2006. Worked in India for like about 2 years.
Okay.
And I came here to do my masters.
So you did your masters in occupational therapy in UK?
Yes, I did my masters in advanced occupational therapy, which is like a specialty degree.
Okay.
And after doing my masters, then I started working here. And my interest was especially in mental health and psychiatry, so I started my career from a residential setting and then moved slowly to a hospital setting. Now I work in a medium secure hospital.
Okay, so you work in one of the biggest multi-specialty, super specialized, purely psychiatric hospital in UK.
Yes.
Right.
Exactly.
That sets the setting. So that gives you a lot of credibility, that gives you a lot of power to talk about occupational therapy.
Of course.
And you have had experience both in India as well as UK, right?
Yeah.
Yeah. So you had 2 years of experience in India, and now how many years have you worked here in UK?
I've been nearly 6 years now.
6 years UK experience. Yeah. So we have an expert here who has had first-hand experience of doing occupational therapy in India, and then moved over here to UK, gained super specialty qualifications, and then has been working here in UK for 6 years. So let's talk to the expert now. Okay, Anna. Let us consider that I'm a person watching this video, and I'm a person from an area which does not have any occupational therapy. So can you actually introduce what is occupational therapy, mostly with regards to mental health, please?
Of course. Before I start explaining occupation, I just want to say briefly about, because not only in the developing countries but also in the developed countries, there's very less awareness of what occupational therapy is.
Yes, I was not aware that there is a department called as occupational therapy till I came over to UK in 2003. Even though I was a doctor, an MBBS doctor, I was not aware of it. So
I'm not surprised anyway. Generally, people used to think occupational therapy is something to do with the occupation.
Yeah.
Generally, it is right, we do with occupation, but not as people thinking it's a paid occupation. Some people used to think occupational therapists help in getting a job. They do.
That is a very good part.
Yes, of course, they do. It's not like an agency or something, but it's to do with the therapy and treatment rather than focusing only on that.
Okay.
When you ask a question about what is occupational therapy, I can very simple to say like occupational therapy is a profession which uses both philosophy of arts and also science together to make somebody's life very meaningful. For example, if somebody has got illness or anything, it could be a physical illness or mental illness, whatever, the patient is or the person is losing their role in the society, being a social being.
Okay.
So the person as a social being is completely morally influenced by the intrinsic motivation and their relationship to the environment, which is completely affected due to the illness. So the occupational therapists work towards that to recover them back into a social being.
Okay, so if I understand this rightly, I am very conscious that this video will be seen by people who don't understand our jargon, etc. So if I think about it from their point of view, what you are saying is that occupational therapy helps people with physical and mental health problems or any other problem, health related problems, to gain their function and role in a society.
Yes.
Is that right? Is my understanding right?
Yes, it is right. For that, we have to work towards different aspects of the individual. Physical, mental, social, psychological, and environmental factors. Because when they have the illness or disability, they perceive themselves as like they are not functionally independent or functionally able to perform in a society as a normal being. So we have to work with them to make them feel that they can do well in the society. For example, using their own way to empower their life.
Okay, so what you are saying again, if I summarize this, is A, occupational therapy helps people get back their function and role in the society. B, they do this using people's own skills, etc. And they do this in various domains, like family domain, social domain, occupational domain, or the job domain, educational domain. So these are the kind of things that you help in, if I understand right.
Yeah. I can give an example. For example, perceive yourself as a being. You might have a different roles. We call it as occupational roles. Not just occupational role means it's doing a job. For example, you're a psychiatrist. When I say occupational role, it's not just about your psychiatry, but also your role as a friend, your role as a family member, like son, father, husband, or different roles. So when some illness or anything comes into place, there will be a complete disruption in their role, performance of the roles. This is because it could be a drop in their self-esteem, or lacking the skills to perform in the society, or lacking the skills to identify themselves as a social being. So being an occupational therapist, we will assess the patient or the person to find out where the problem exactly is. You could be having all the skills pertaining to your occupation. You could be a very good psychiatrist working as a psychiatrist, but there might be other problems related to the family or in the society to perform yourself as a social being. So we identify that factors and try to strengthen that area so that you can feel that yourself, you're a part of a society and you're a complete social being.
So again, summarizing what you have said, what you are saying is, for example, if fortunately or unfortunately I have a mental illness like schizophrenia, for example, my functioning the role of me being a son to my parents, me being a brother to my brothers and sisters, me being a husband to my wife and father to my children, my role as probably a psychiatrist, my role as a writer maybe, all these things get affected. And what you, the occupational therapists, do is try and regain as much of a functionality as possible to recover the functionality that have been lost because of the mental illnesses by doing specific interventions. Am I right in understanding this?
Exactly. And also I need to find, not just because I want to get back to your own normal job or things like that, not only that, I need to find which is meaningful for you. You could have felt that is not really meaningful for you. So you have something else which makes you as a complete being. So you would think, as you said right away, that could be your motivation and meaning. So I can focus only on that, not necessarily to think about the rest of the aspects. Because for you, the writing could be something very meaningful for you. So you can work towards that and help you with all the areas where you can get back to the stage where you feel your life is meaningful and you feel your own strengths and values.
So you are telling me that I have different roles, but the priority of the roles which you will try to recover and the hierarchy of the roles, that is whether you will, which is the role that you will first try and recover, which is the role that you second try and recover, etc. This hierarchy or the order in which you recover these roles will be directed by me as a patient or a person with mental illness rather than the societal expectations or a therapist expectation.
Exactly, you got it exactly right. That's the advantage of being an occupational therapist. What we see is the individual as a whole individual rather than the problems. Identify as Raghu in society.
Rather than me as a patient with schizophrenia.
Yes, exactly.
Or as a schizophrenic, as we doctors wrongly tend to call people.
So I would look you, so Raghu, what he feels meaningful for his life, what he thinks is recovery for him. So I'll be focusing only on that. I will identify all your strengths. I know there are some issues with your weakness and things, but I'll be focusing more of strengthening your own strengths, which will give you more self-esteem and self-confidence, and then help you to identify your own pathway towards your success. So we'll be working with you rather than saying that you will be doing what I'm saying.
So
we're working alongside of that. That's why you could see sometimes the therapeutic relationship of an occupational therapist with the patients are more positive. They will be always focusing on the positive, saying
than with the psychiatrist who wants to inject him. I take your point. Touch there. Right. Now, Anand, I was thinking of something. In my discussions with occupational therapists, I keep finding three words that they always, or three domains that they always say that they work in. One is they say that they work to help in something called as activities of daily living. And the second thing they say is leisurely activities. And the third thing is they say about productive activities. Now, this is how I remember an occupational therapist as. That's all. When I wanted to understand what an occupational therapy was, these three are the things that I always remember. Can you explain them a little bit more in detail, please?
When you said that's the core aspects of occupational therapy, we normally call it as occupational performance areas, performance context, and the performance components. I don't want to go detail into that. It'll be too much.
Just explain those three things so that people can understand what is it that you actually improve in a patient. I'm a patient with 20 years of schizophrenia. I'm sitting in my house. I'm not going anywhere. What is the thing that you are going to help me and my family to actually see concrete improvements?
Of course.
Giving examples, can you explain those three?
Yeah. As I said, we look into the individual as a social being.
Yeah.
We normally divide the individual's role or their life, the daily life, into three important parts. So every individual will have definitely that three important parts to satisfy themselves as a social being.
Okay.
For example, if I say like being a doctor, when I say you're a doctor, that comes the work. That's the work you perform for the earning, for the livelihood.
Yeah.
That's one part. When you said about activities of daily living, exactly, that involves all your self-care activities, your domestic skills, and all the activities you do in the community. For example, if I say you're brushing, eating, grooming, and associated self-care activities like going out, using the transport, going and using community resources, and all these things would be a part of activities of daily living.
Okay.
And then when you say about leisure, it will be something like meeting your friends, going outing, pubs and stuff like that, which makes a complete social being.
Okay.
Anyone who lacks in any of this area could be very difficult to identify themselves as a social being. For example,
don't say, please, don't say. In Indian context, don't say that going to pubs is a very important social aspect.
That's what I'm saying in Western. But again, leisure is not necessarily the pub. Even if you spend with your family, having a chat, conversation.
I was just pulling your leg. Sorry about that.
So that's all right. Yes, leisure could be anything. Meeting your friends, meeting your family. Something you do for yourself. As you said, your writing could be one of your leisure activity. Could be. But it could be a paid occupation as well.
Okay.
It's again, but we should have the balance in all these areas. When you lack, for example, I spend more time in work. Like for example, I'm not focusing on my family, I'm not focusing on any other activities. I'll be spending more time on the work. I'm sort of person because I'm telling my patients how they can balance their life. I'm very poor in that.
Okay.
So,
we all are.
People used to call me workaholic because I spend more time at work rather than involving the leisure activities. But no, activities of daily living is fine. Obviously, that will affect my personal care. But yeah, some areas could be affected. So which will again put them less in front of the society.
Okay, so let me understand this a bit more. Let me summarize this. What you are saying is, me, a patient with bipolar affective illness, manic depression as we call it, having this problem for 20 years. I'm a psychiatrist and I do have this problem, let us say. So, what you are saying is that if I have problems in my daily activities. For example, I get up in the morning, I brush my teeth, and then I go and have my bath, and then I dress myself up properly, and then I have my breakfast, and then I go to my job, and then I come back in the evening, and then I be a father, I be a wife, husband to my children as well as a wife. I'm a son to my parents, and then I go to bed. So this is my whole daily life. So if any one of these are affected because of me having a mental illness, for example, bipolar illness, what you are saying is that you would concentrate initially on, if there is a problem in the domain, on activities of daily living. For example, if a person is not able to brush on his own or perform self-care, hygiene, like having bath, etc., on his own, or not eating properly, etc., you would help them initially in what is called as the domain of activities of daily living. That's the initial domain, right? And then you are saying once a person is self-sufficient in activities of daily living, you would go then a bit higher and try and recover their skills in leisurely activities.
To identify where they are lacking in their personal care. So I'll be working on that. At the same time, we'll be having the opportunities. It's not necessarily they have to do it. We'll be having opportunities to start with the vocational pathway as well.
Okay.
So some activities, it includes the therapeutic groups or individual
vocational
activities.
pathway in the sense?
When I say vocational pathway, it's a part of vocational rehabilitation. Like for example, as you said, any individual to consider as a social being, something like we need a work for their livelihood.
Productive activities.
Productive activities.
Okay.
It could be a paid occupation or it could be something incentive to give their life a self-sufficient.
So you're like a volunteer job.
Volunteer job or whatever.
Okay.
So we will be working on that skills. For example,
Okay.
work behavior, for like being punctual or being consistent in their work pattern and stuff like that. So we work on the basic skills.
Okay.
So it can start from there, not necessarily that we have to wait for until we finish that activity. So it can be all together.
So these three things, that is leisurely activities, activities of daily living and productive work-life things, what you do interventions, that therapy that you do in these three domains don't need to be one after the other.
No.
They can all run parallel.
Not necessarily.
Okay,
yeah.
right.
It can vary from the individual to individual. For example, if you take a chronic schizophrenic patient, we wouldn't be working more on that area because up to them, the self-care will be focusing more on that to identify themselves as like...
Depending on the patient, individual.
Yes, individuality.
Okay.
Yeah.
So, if I understand it rightly, what you are saying is, you will recover the functioning, a meaningful functioning, meaningful from the person's point of view, not from the therapist's point of view. So, you will recover a meaningful functioning from the person's perspective and obviously later on the family's perspective in three domains, that is activities of daily living, taking care of self and others, leisurely activities and then productive activities, so that they have a meaningful and structured daily life, so that they feel very much well and confident about themselves.